Bom dia a todos. I am always very happy to come back to São Paulo and to see Victor and the people here. It's an enjoyable time for me. I'm here representing the American College of Sports Medicine, and one of the things that the college did over the last couple of years is to start something called Exercises Medicine, and I want to explain a little bit about what's going on there and how that is going to try to improve the amount of physical activity that people are doing. And the main way, one of the main ways of doing this is to have physicians ask their patients as a standard part of their information, just as they ask them what's your blood pressure, what's your height and weight, we want to ask them to start asking about your physical activity. The idea being that if you ask about something, the patient may begin to think, well, maybe this is important. I should be doing something about this. And so we're trying to get physicians to do this. And in the United States and a lot of other countries, the amount of physical exercise and physical activity taught in the medical schools is essentially very little. There are places where they'll have 1 or 2 lectures and a whole couple of years at the medical school. So physicians don't have the time and they don't have the knowledge. And so as a result of this, they don't spend a lot of time talking about physical activity. So we are now in the second phase. The first phase was to try just to raise awareness and to start establishing national and regional centers. The idea being that what you do in Latin America is going to be different from what you do in Europe or in Asia, and so we have each country has their own national center and their own approach to doing this. What we're doing now in phase 2 is we're going to start implementing the programs of trying to get physical activity as a vital sign, and to teach the healthcare providers as well as the fitness professionals to encourage and prescribe physical activity. And then following up with what Imin said, we also want to, in this phase, we want to start determining if we do this, is physical activity actually increased? Because we can talk about it, it's a very good idea, but if nothing is happening, then we're just wasting a lot of time. Because we know right now that we have a lot of people entering the healthcare system inactive, obese, have all kinds of problems where exercise can be of benefit. So what we're hoping is that Exercises Medicine will be a way of building a bridge between the healthcare community and the non-clinical healthcare community, which would be the dietitians, the nutritionists, the physical educators, the fitness professionals, that sort of thing, so that not only are physicians prescribing it and encouraging it, they're also referring it out to the community and trying to get people to be more active in that sense. And this is the what's called the solution flowchart, and it starts with the medical profession. It starts with the healthcare professionals who work with patients at risk, and as well as patients who are more or less normal but just inactive. And the idea is that the healthcare professionals and also the insurance companies and the employees, big large companies, they start this thing going by saying this is something we want to do. And then it goes to the intervention advisors. And so there you're talking about the medical assistants, the care managers, the health coaches, because physicians don't have a lot of time to spend talking about exercise. But we want them to find out about it, but then we also want the next level to start getting more information and give them little handouts. We've got flyers now on 45 different health states. They're being improved right now. The first go around was just to get something out. Now we're actually working to get more information in there. Then that gets the idea. You hand something to the patient. Then the patient goes out. Then the next thing, and this is where people in Agita Mundo and Rafa Pan and some of the other people, we have the network access where we get people who deliver the physical activity intervention programs at designated places. And what we're going to be doing now is we're starting to develop certification programs for people who are working with physical activity and adults and children in different groups. But the idea that they understand a little bit about exercise and heart disease and diabetes and obesity, that sort of thing. You have to realize, though, this starts, the way this thing is set up, it starts with the healthcare getting information and referral, and then you have to have someone to whom you can refer. And this is where what we're going to be talking a little bit today is about here, so we need to get into that mode. And so what you need is to get people who are trained to deliver the programs, and we want to get it credentials so that they say, okay, I know how to work with a person who's at low risk or moderate risk or high risk. Now what's happening in the United States is physicians do not refer just to, you have a health club, and maybe a very good health club, but physicians aren't referring patients there. You may have you have people who are very, very well qualified. They're not being, the physicians don't know about them. So one of the things that Exercises Medicine is doing is getting a list of people who are certified. Now, we have our ACSM has its own certification at a little bit higher level, but Exercises Medicine is going to start certifying at a certain level. There are other organizations like the American Council on Exercise, some other groups that do certification, and we're saying that if you have any of these 5 or 10 certifications, you will be listed so that a physician in a city in Bogota or Sao Paulo or in Chicago can say, okay, I have a patient, the patient needs help, where do I send him? Well, now we have a list. They go on the website and they'll say, in the city of Chicago, there are 200 people or 50 people or whatever, and these are the people to whom you can refer. And we're hoping that if that happens, then people who need the activity for health reasons are going to be going there and trying and getting good programs by people who have credentials to meet the quality standards required in the healthcare, because the healthcare people don't want to just send them to a place and not know what's happening. So there has to be communication. But we think if we do this, not only will we improve healthcare, we will improve the physical activity of the populations. So what have you got? You've got your designated places where they can go. Well, some have already been mentioned. We have community centers, we have parks. Rocio talked a little bit about how they do that in the community, in the parks, other places, and you've got a whole series of places where you can go and become more active and get better health care. And at the present time, we have 40 national centers and 7 regional centers. So we have North America, South America, Africa, we have Russia and China, and then we have Australia, and then we have Southeast Asia. So we're still working on getting more countries in, and eventually we hope to get as many as we can. But we have 40, we're over 40 right now, and I believe that we have 2 that are just getting ready to come in, so between now and the end of this year. So we're working on this, and we hope to have this presence. So our next step, this follows, I'm glad that Ayman spoke before I did, because she said, what do we need to do? We need to do research to find out, are we making a difference? And this is what the next step is going to be, to do pilot studies to see if physical activity actually increases if the healthcare professionals prescribe it, and or refer them to the patients with the community-based programs. Now, the people, the fitness professionals are not the one who drive this. It's the healthcare professionals who refer, prescribe, and say, now go somewhere and get this. And that's what we're hoping. So I would like to make a challenge to Rafa Pana. When we had our meeting in Santiago, Chile, just last month, one of the things that Rafa Pana said they want to do is become more associated with Exercises Medicine. And so I've been working on that since that meeting. And so I want to challenge that we're going to try to get some pilot studies going in various countries to find out whether or not this is being effective. Now, the problem that we have is that Exercises Medicine doesn't have the money to give to do these studies. So we're hoping that some of the national centers will be able to get money from their their national government to do this program and actually collect good scientific data, not just general ideas. And so we want the people from Rafapana to start working with the people with exercise as medicine in different countries to see if they can become part of this study so that they can help collect the data from the physical activity side, and the physicians and the healthcare providers do it from the other side. And I see this as a situation that's a win-win for both sides. If we can get the physicians more involved with the fitness professionals, the activity professionals, we can get them involved with the healthcare providers. It's a win-win for both the groups, but it's also a real good situation for the active people, the people who become more active, and that is the clients and the patients. So I just wanted to let you know what Exercise as Medicine is doing to show you that there is something going on. And this will help, I hope we get good information that says by doing this program we are starting to increase the amount of physical activity and the quality of the physical activity throughout the world. Thank you for your attention.
Buenos días a todos.